Hello everyone, welcome back to my channel. Today we are going to discuss an important topic for your exam, and that is Hirschprung disease. So you often get short notes from this particular topic in both UG and PG, and also this is important for all the NEET PG aspirants because many a times many MCQs have already been asked from this particular topic. So do watch the video till the end so that you do not miss any of the important information, right? So let's get started, students. So Hirschsprung disease is also known as congenital aganglionic megacolon. Okay, and what is this? This is basically a developmental anomaly, okay, of the enteric nervous system. Okay, ENS, enteric nervous system, and this is termed as neurocristopathy, right? So each of the terms I am using is your MCQ, okay? So as the name suggests, that there will be absence of ganglionic cells in the submucosal layer and the myenteric plexus, okay, and the incidence in male is to female is 4 is to 1 in case of short segment and 2 is to 1 in case of long segment, right? And now, what is the clinical feature? And one more thing, student, it generally affects your term in neonates, okay, not the preterms, okay, and this is the most common cause of lower intestinal obstruction in neonates, okay, and they present to us with abdominal distension, failure to pass meconium or delay in passing meconium. Okay, so as you know, students, a healthy term neonate passes meconium within first 48 hours of life, right? This is also an MCQ. Okay, so there will be a delay in passing the meconium in this particular disease, okay, and of course, as because there will be delay and there will be abdominal distension, so definitely there will be some features of feeding intolerance and there might be some bilious vomiting or emesis, okay. And if this is not presenting in neonate, or we are failing to diagnose in neonate, then in younger children they present to us with chronic constipation, okay. Well, and in this neonates, sometimes what happens is they present to us with features of enterocolitis as well. Why? Due to the stasis, there might be some reduced blood flow, which leads to bacterial proliferation and thus leading to your enterocolitis, which is manifested as your diarrhea. Okay, so these are the common manifestations of your Hirschsprung's disease, right? Now, moving on to the diagnosis, how you are going to diagnose. So, rectal suction biopsy is your gold standard test, okay? Often asked in MCQ, and you are going to take the sample no closer than 2 centimeter above the dentate line, also an MCQ, and you are going to stain it with acetylcholine esterase, MCQ. And if it fails to diagnose or stain positively the enlarged nerve roots, then you may stain it with calcitonin. Clear, students? Okay, so other than rectal suction biopsy, what are the other provisions we are having? Yes, we can go for anorectal manometry that will measure the pressure of your internal sphincter, anal sphincter. Okay, and if it's more than 1 month, okay, then we will do a very doable thing, that is your contrast enema, right? But this contrast enema is often normal in 10% of cases of Hirschsprung disease. Clear? Now, moving on to the last part of our lecture today, that is the treatment. So, as you know, students, this is a surgical condition, so definitely the treatment will also be surgery. Okay, and what are the three named surgeries we are knowing for Hirschsprung disease? So, one is Swenson, other one is Duhamel, and the third one is your Soave. Okay, so each of them are your MCQs. Okay, Svensson, Duhamel, and Soave. So this is all about your Hirschsprung disease, students. So thank